Hello all, this is Dr. Alsip, and while we have a great focus in the cranial cavity and brain session on the dural venous sinuses, there are a few veins that we want to discuss, and a few we're going to more talk about conceptually, and a few we want to be able to actually identify. So let's get started. So we'll start with the ones that I think we need to think about a bit more conceptually. They are difficult to see in dissections. We'll talk a little bit about where they could be located. And these are the emissary veins. These are connections between the external portions of the cranium, so mostly associated with the scalp, but in some other areas as well. So that connection between that external part of the cranium to the dural venous sinuses. The flow of blood is typically away from the brain, but not always. So you're going to have emissary veins in many different regions. Sometimes they will be missing in these regions. Sometimes there will be more than is typical. So there's a lot of variation here. Now, there is a little bit of one that I think you can see right about here. And I can see a little vein kind of popping out from the meningeal region. So it's popping out from the inside of the cranial region, likely where it was heading towards, through the bone, towards the scalp region. It is not going to be anything in this region. These are going to be part of the lacunae, where those arachnoid granulations are moving into that region. So like I said, it's difficult to be able to see emissary veins, but we want you to conceptually understand them because they're important clinically. You can have infection that can kind of move through these regions. Now, this particular one would likely be part of the frontal emissary veins. You will also often have parietal emissary veins, mastoid emissary veins, which are closely associated or in the near vicinity of the mastoid process, as well as posterior condylar emissary veins. Sometimes these are referred to as occipital emissary veins. Okay, now let's talk about the superior cerebral veins. Typically you have about 8 to 12 superior cerebral veins, which are the superior most of the superficial cerebral veins. And as you can see here, these are draining into the superior sagittal sinus, which is located right about here within the falx cerebri. These veins are going to drain the superficial superior portions of the cerebrum. And lastly, we will discuss the great cerebral vein of Galen. This is a single midline vein which was formed inside the brain by the union or the coalescence of two fairly large internal cerebral veins. So I have two different views here. We're looking at a superior view with the calvaria removed here. This is the tentorium cerebelli, right here and right here. And the falx cerebri has been removed, but you can see a little bit of it right here. And you can see right in this region, that is going to be the great cerebral vein. You can see it a little bit clearer here. Here's that falx cerebri that has not been removed. That nice, very obvious sickle-shaped dural partition. This is the tentorium cerebelli. And this little portion right here is the great cerebral vein. The great cerebral vein is going to meet up with the inferior sagittal sinus, venous sinus, which is going to be located here. So these two, the great cerebral vein, will meet the inferior sagittal sinus to form the straight sinus. And that straight sinus is going to be located at the meeting point of the falx cerebri and the tentorium cerebelli. All right, so that is going to be our quick review of the veins that are associated with this session. Like I said, we'll spend considerable more time and have a separate video where we discuss the dural venous sinuses. As you review this, and if you have any questions, please always feel free to reach out to me. Thank you very much for your time.